Hi, myself Soumya Rahul, an online CBT trainer, and in this session we are going to discuss about an introduction regarding CBT. So, what is CBT? CBT is a computer-based test conducted by NMC. NMC is a Nursing Midwife Council UK. This is mainly aimed at those who have trained outside the European Union. That means if the nurses from any other countries want to work in UK, they have to clear the CBT exam conducted by NMC along with their IELTS or OET. So the CBT is a computer based test which contains 120 multiple choice questions, and it is a 4 hours test, 4 hours, and the duration of the test is just 4 hours, and it is purely based on the nursing topics. So in this you will get calculations, critical thinking questions, and questions from all our medical, surgical, nursing. So in CBT we have special topics like domains. There are 5 domains to be learned. In this also it is included, all the nursing subjects are included. So mainly it is our code. That is a code, how you behave with the patients, how you get a trust from the patient, what is the therapeutic communication, care of adult, care of geriatrics, then prioritization of the care, and biomedical waste management, accountability, responsibility, nursing ethics, and principles has to be studied on all these things. And along with that, you have to learn some nursing topics, and other things are calculations, drug calculations. So, drug calculations are very simple. That is, we can easily calculate the drugs by using the standard drug calculating formula, and the drop factor, that is a drops per minute will be asked, the flow rate will be asked. That are the some things you get from for calculations. So the nursing topics some are asked is regarding pressure ulcers, types of wound healing. So types of wound healing is one of the important topic in CBT. That is wound healing. Whenever there is an injury occurs to the body has its own mechanism to heal the wound, but it takes some time for different size and type of wound. So for larger wounds, body takes some time, more time, and for smaller wounds it is takes less time. So the process, the stages will be same for all type of wound. So first thing the body does is hemostasis. Hemostasis is nothing but stoppage of bleeding. First the body stops bleeding. Second phase is inflammation. Inflammation is nothing but from the beginning of the wound you will have an swelling around the wound. That is nothing but the body removes the debris, the pathogens, the bacteria from the wound site. That stage is called as inflammation. And the third stage is called as proliferation or fibroblastic stage. That means formation of new blood vessels, new cells, collagen deposition, epithelialization. That is everything will be newly formed in the fibroblastic stage. In the last stage is called as maturation or remodeling. That means the scar tissue becomes thinner and all. So this is a natural way of wound healing. That is called as hemostasis, inflammation, fibroblastic stage, and the last stage is maturation or remodeling. So we have a major role. That is, whenever the patient comes to your department or emergency, we will be doing some dressing, debridement, suturing, all those kinds of things we'll be doing for wound healing. That is, to enhance the wound healing, we are doing something that is called as healing by intention or intentional healing. That is an important topic for all the nursing competitive exam. That is healing by intention or intentional healing. That means, so for wound healing enhancing, we can do so many things. In that, first thing is you can suture the wound. If it is a clear cut, you can suture it without any complication. It is a straight cut, laceration, or a surgical wound. We can suture it or staple it. We can join the wound by something. That is called as primary intention. If the wound is able to be sutured, if it is a well defined wound, so that you can suture it or staple it or whatever you can do, that kind of wound intention is called as primary intention. That means the suture which can be, the wound which can be sutured is called as primary intention. Primary intention. Example, our clear cut lacerations or surgical wounds comes under primary intention. And the second one is called as secondary intention. Secondary intention, the best example is pressure ulcer. That means we know the from pressure ulcer, from the center some tissue will be lost, so that we cannot suture it. What we can do in that, we can only remove the debris, you can clean the wound, remove the debris, and you can wait for granulation. So some tissue is lost from the center, so that you cannot suture it. That kind of wounds are called as secondary intention. The best example is a pressure ulcer, the wound which cannot be sutured, only debridement can be done, the removing of the debris to enhance the wound healing can be done. That kind of, it is called as secondary intention. The best example is pressure ulcers, that is a pressure sores, and our tooth extraction sockets. These all comes under secondary intention. And the last one is tertiary intention or delayed primary closure. That means some wounds will be purposefully left open. Like example, our appendicectomy. If the appendix is ruptured, the wound will be left open, or you will have a drain for it. So purposefully left open wounds are called as tertiary intention. So you will be watching the wound, how the wound is healing, and later it will be sutured. So later suturing wounds are called as tertiary intention. See, mostly contaminated wounds comes under a tertiary intention. So you will be waiting for the healing, and the last later, or 3 to 5 days or 1 week after, you will be suturing the wound. Such kind of wounds are called as tertiary intention. So these are called as healing by intention. Primary means those can be sutured, secondary those cannot be sutured, and tertiary is those purposefully left open and sutured later. So this is called as healing by intention. So this is a very small topic from our CBT syllabus. So by clicking the below button or apply button, you can join for the courses what we offer. And thank you.